I was living in Colorado, and I went to nursing school there at Colorado State University, and went to my advisor and just talked about what her experience had been with nursing. And she'd worked at Johns Hopkins and had a great experience there, and she recommended that I find an organization to work with that mirrored my personal values. And I started looking around at different places and found that Mayo Clinic had this new graduate nurse program. So I was ecstatic when I was accepted, and my family and I relocated from Colorado to Phoenix, and everything flowed really well. We had a lot of education. They helped us pass state boards. We were in a group together where we could come back and talk about the challenges we were facing, and just a lot of support from the education department. So we also were assigned preceptors where we had a lot of time on the unit to really learn processes and keeping patients safe, and also just help get us into the culture of Mayo Clinic. I think excellence, when I think of Mayo Clinic, I think of excellence and innovation. Mayo Clinic to me is very cutting edge. Growing up in Colorado, it was when a person had a problem, they couldn't find what was wrong, they went to Mayo Clinic, and there were always new things happening there. So that's what I think of when I think of Mayo Clinic, and also just the excellence, the reputation behind it. I think the culture here at Mayo Clinic is carrying on the legacy that was here before us, that was set by the Mayo family, and very much focusing on education and a teamwork environment. And I think that because we're all employees here of Mayo Clinic, we work really well in the team environment. Everything was great. I had a very warm welcome from everyone. They immediately greeted me like I was family and took me in. So we had time to spend with different people throughout the organization that work in different departments who helped give us some education and a face to put to a name if we needed help with something. We also had a day where a volunteer took us around the whole campus and explained what buildings were ours and where the property line ended, and a very in-depth, detailed view of our beautiful campus. Well, I think the mission, our three shields, education, practice, and research, it happens here every day. You see it at the bedside. We are always trying new research, implementing new research, asking patients if they would like to participate in the research that we're doing. We have it not only with our providers, our physicians, but nurses do research here as well. And just that constant change and improvement, a lot of innovation coming through that we're putting in place with practice. The needs of the patient come first. I would be willing to say every employee here knows that. We hear it, we're taught, it's how we work. And it does happen, and even whatever role, even as a manager, that means if we need help, I go out and help. It means that every call light is our call light, and we're just working here together to meet the needs of our patients. I think teamwork is just the communication and collaboration between everyone, and no one person being more important than another. I had a physician in Arizona tell me as a nurse I had to make some phone calls during the night, and was just asking a lot of questions and needed some help. And he said, we're all very important here. Patients come here to the hospital because they need nursing care. So this is our patient, and we're going to work through this. So I think having that reassurance and knowing that we're part of a team and helping each other out, and it works here. I've seen it. I'm proud just to be a part of the legacy and carrying on the culture and the innovation, everything that Mayo Clinic stands for. I think looking back at the history of Mayo Clinic, there's a very rich and strong history with the Mayo family, and being able to uphold standards and excellence and expectation and quality, everything, all of the hard work that they've done, I'm just proud to be a part of it. Well, I've come to find that we strive for excellence. So we are not trying to meet the minimum criteria. We're not trying to get by and do what we need to for different organizations. We are trying to be 100%. That's what we shoot for. And so, for example, with patient satisfaction, we want to be 100% with our patient satisfaction. We want them to rate us excellent. We're not happy with anything less than that. And having those goals, it continues to help us drive and to get better and to improve and increase our quality. I've seen that demonstrated in different ways. Some ways I can think of are when employees have had a tragic situation in their life for some reason outside of work, other staff coming together to cover shifts or find out how they can help and just be very supportive to them through their difficult time. I think also when you know that one of your coworkers is having a difficult day here at work, or it's just a little busy, pitching in and really helping out and taking care of each other. I would tell them to find a mentor, find a person in a role, it doesn't matter what role, that can help guide you through the process of how they got there or where you want to be, and to be able to set some goals and take advantage of our educational opportunities here. I have a master's degree that Mayo Clinic paid for. I've taken several classes when I was going into the master's program to learn how to do PowerPoints and different spreadsheets and things. And a lot of those classes, they're free. All of them are free, in fact. But being able to take advantage of that education and have that mentor guide you through the culture and help you get where you want to be.